Hello, ladies and gentlemen, boys and girls, golfers of all ages, and welcome to another episode of the Golf 360 podcast. My guest today is the famous Dr. Stuart McGill. Dr. McGill is a distinguished professor emeritus from the University of Waterloo in Ontario, Canada, where he was a professor for 32 years. His laboratory and experimental research clinic investigated issues related to the causal mechanisms of back pain, how to rehabilitate back pain people, and enhance both injury resilience and performance. His advice is often sought out by golfers, trainers, therapists, and others from around the world, and his work has produced over 245 peer-reviewed scientific journal papers, several textbooks, and many international awards, and he has mentored over 37 graduate students during his scientific journey. He continues on as the Chief Executive Officer for BackFit Pro and works on difficult back cases and elite performers who are regularly referred to him for consultation. I will say that Dr. McGill was very gracious to give all of our listeners a discount for any of the books or videos on his website. Simply enter BFP Golf 360. That will all be in a summary, as well as his books that I highly, highly recommend. Back Mechanic, Gift of Injury, which he wrote with prior guest Brian Carroll, and the videos, The New Science of Golf, where he was featured alongside World Long Drive champion Lee Brandon. And you can also get the Back Mechanic book with video streaming models as well. Now, to get into today's show, we really have three different sections. And we discuss in the first section the basic anatomy of the back, the physiology, and the neuroscience. We follow it up with a great discussion on measuring the muscular sequencing and the patterning. And Dr. McGill gives a great description of what pulsing is and why that is so important. And then we finish off the episode with a discussion really focused around training and training for golf specific. For example, is why stronger is not always necessarily better. What's more important, pliability or strength for you in your golf game, and the importance of rest for adaptation when training, especially when returning to golf from a back injury. So obviously a wonderful show with arguably one of the best people in the world when it comes to rehabilitating the back and the spine to get you back to being active and playing golf and doing the things you love. So please, as always, sit back, relax, and give a very big Golf 360 welcome to my guest today, the world-renowned back and spine specialist, Dr. Stuart McGill. Very lucky to have world-renowned back expert, Dr. Stu McGill. So, Doctor, thank you for taking time out of your vacation to sit down with me and talk about all things back and golf.
Thanks very much, Pete. We've just enjoyed a beautiful breakfast together here on Hilton Head Island, and it's been a joy so far. So let's
dive in.
Yeah,
getting into golf and the back in particular, as the back is the number one cause of injury for golfers across the planet, across genders, age groups, levels of play, beginner to the best professionals in the world, as we've seen. But I thought before, in getting into that, I think having a general understanding of some basic physiology and neuroscience to give the listener a base level understanding of things that we'll talk about throughout this show. So can we start there with the physiology and the neuroscience of the back?
Yeah, well, when I started my career as a young scientist, I only had one question, and that was simple: how does the back work? And from there, I would present at different medical meetings and then eventually some sport meetings and whatnot, and golfers would come to me and say, oh, well, that's, really interesting what you're learning about spine function. Could you see me for your back? And I ended up seeing, as you know, quite a number of top-level golfers. And the other component of that was I didn't just see them as a clinician, I measured them. So we developed very special instrumentation to measure their muscle activation sequences, three-dimensional spine motion, the force imparted through their feet to the ground, which worked up through the linkage to allow us to determine their strategy that they would use with the hips, and working through the linkage of the spine and putting energy into the golf club shaft as it deflects, and watching it kick and boring the ball and all of these things. But to understand what we were seeing, we do have to get back to the features of being a human, which is a true spectrum. So when you think of something as basic as muscle contraction, everyone is aware that the brain activates muscle to create force. But what they often miss is the act of creating force also creates stiffness. So if you maximally contract, squeeze your fist and contract your bicep muscles and the muscles around your elbow, you can't move your elbow. It's stiff. So if you were going to hit a tennis ball or throw a punch or hit a golf ball, you cannot use too much force and muscle activation because the muscle becomes so stiff you can't move. So we realized in measuring these different sports that the great athletes are actually muscle pulsars. And the hallmark of many great athletes, and golf being one of them, is the rate of the onset of the contraction, but even more importantly, the rate of relaxation that allows, you can think of a punch, there's an initial pulse of muscle, then relaxation of the muscle to create closing velocity from the fist to the target. Think of going into full backswing and then initiating the downswing with just a little bit of a pulse. But if you try too hard, you never hit a long ball because of the stiffness that accompanies that. So the art of it all is to create that initial pulse and downswing and then allow through tuned stiffness, F equals Kx, K being the stiffness, X is the deformed distance of the elastic member, which, as we know, is not only muscle, but the muscles. I know people talk about muscles being agonists and antagonists, but I learned to appreciate that these don't exist. The fascia and the elastic tissues of the body create all muscles as being agonists to that controlled, you've heard of tensegrity, where this is balanced. That is what creates the speed of the club head. But just before the club head hits the ball, there is a little bit of a cracking of the whip and a pulse of stiffness, usually originating out of the trailing glute. So if you shoot right, it'll be the right glute, and then it emanates down the leg. And we can talk about force production on the ground and the spectrum of how this pulse is unleashed. So I've talked already now some neurology in the rate of muscle onset and offset. I've talked about basic muscle physiology, but now I need to talk about the spectrum of anatomy. If you take a thin willow branch, you can twist it and bend it over and over again, and it will not break. However, if we held that branch up and loaded it with some compressive load, put something on top of the branch, it would bend and buckle and break very quickly. Mm-hmm. The polar opposite of that would be a thick branch that you could also load in compression, and it will withstand the load, but if you twist it just a little bit, it shatters. So most golfers, being tuned, elastic, pulsing athletes, do not have a heavy skeleton. They have a more slender style of spine anatomically. And that so facilitates the storage and recovery of elastic energy together with resilience. Every spinal joint has three major articulations. You're aware of the disc being between each vertebral block of bone, and then the two joints behind that are the facet joints. As it turns out, the angle of the facet joints determines whether even in fact you will be able to play golf and twist your spine or not. So me, as an example, I have what are called closed facets. The joint angle, the interface articular angle of the facet joints is very fore and aft on my spine, which means I can flex and extend with no stress. The joints just glide past one another, but they butt up against one another when you twist. So I'm not a good twister. However, when I've measured the great golfers and I go through their MRIs, because they come to me not for golf coaching, they come to me because they have debilitating back pain, their facet joints are open. And what I mean by that is the angle of orientation is right to left, which allows them
Allows it to move.
it allows them to twist without very much stress at all. However, if they arch backwards now, they put a real stress concentration into what's called the pars, which holds the facet joints on. And you'll see the incidence of those kinds of achy backs in golfers. So the mobility now becomes very strategic if you are rehabilitating or trying to first desensitize that person's specific back pain.
I'd like to take a brief break to acknowledge one of our affiliates. Are your golf shoes an accessory item, or are they a piece of your equipment? Well, at Painter Golf, it's definitely viewed as a piece of equipment, and with that, something that can greatly enhance your game. Painter's technology platform is really grounded in their ability to deliver traction that's going to allow the golfer to better harness ground reaction forces. If you look at their outsole technology, it's about looking at traction in 3 dimensions. They want to prevent rotation, they want to support horizontally, but what really sets them apart is their propulsion plate. It's really about the modern golf swing and what coaches like myself are teaching. They're talking about pushing into the ground. You push into the ground, you get that back and energy return. And that energy return is what the golfer uses to bring power and speed to the golf ball. You can check out Painter Golf Shoes via the link in our summary or at www.paintergolf, that's PAYNTR golf.com 360. Can I ask you a question on that?
Sure, yeah.
As your career goes back 4 decades,
Yep.
give or take, American golf in relationship to European golf, largely because of the weather conditions, and we'll use the UK as an example, Scotland, Ireland, Britain, in the wind particular, that the swing style, at least going back to the 80s and 90s when I was coming up playing golf, that the swing style was more of a level finish without the arching of the lower back, because in Europe and the UK, because they wanted to keep the ball flight down. But in America, there's just the architecture of the golf courses and the difference in the U.S. we only tend to play in the summertime or when the weather is good and limited wind, and the course designed to where you had to bring the ball in from much higher, that there was the old classic reverse C type finish. So the question that immediately pops into my mind, and maybe you've had experience with this, maybe you didn't at the time, did you see more issues with American golfers given that the swing characteristics of what they were adhering to of the reverse C versus people coming to you from Europe that did not employ that type of swing methodology? Or was it the time they just golfers had not gone to you as much as they did, let's say, in the last 20 years?
All of that.
Okay.
Yeah. So I haven't noticed a geographic region particular to a certain pain generator mechanism in golfers. I do see very specific patterns based on their anatomy, their neurology, and their physiology. And on top of that, they may have gone to a guru coach who changed their style to fit what the coach thought was the perfect golf swing. And as we all recognize now, that doesn't exist for everybody. The perfect golf swing is only perfect for that individual because of where they are on the spectrum of all of these traits of function that I'm talking about. So that's my answer. The assessment that we do of each individual will reveal their potential that you can develop, but also the mechanisms of their current pain that you really have to avoid and allow it to desensitize and train them strategically to adapt whatever that mechanism is, if possible. You just may have to stay away from it.
So it might be damaged to a point that even the great Stu McGill's magic is only going to get them so far as their health of their back is concerned?
Correct.
The damage has been done, basically.
Right. But that's not always the kiss of death. Occasionally, it's very difficult to come back to being the top player, dominant player, once that damage has been substantial. The discs, if they are delaminated, and what I mean by that is the disc is not a ball and socket joint. And too many athletes, particularly the elastic mobility athletes like golfers, treat their spines as though they are ball and socket joints, but they're not. The discs are considered a adaptable biologic fabric. So if I was to take my shirt and with both hands, I'd work the shirt back and forth, creating stress-strain reversals. The fibers may not tear, but what they do is they pull apart, they delaminate. So the material that holds the fibers together in the disc is a certain type of collagen. So the collagen fibers are predominantly type 1, which is the strength collagen. There's about typically 20% or so that's the elastic type of collagen, type 2. And then there's a third type of collagen that binds all the fibers together. To be exact, they are types 3 through 10. The biological variability is really in the binding collagen. So there are some people who just through their parents were gifted with a type of collagen that can take many stress strain reversals and the fibers are held together. And there are others where it just debonds and delaminates much more quickly. Now, it doesn't mean that they are excluded from a lifetime of golf. What it does mean is they have to be much more specific and judicious over the style of training that they're doing. So those who want to be a very elastic golfer with a high X factor in the spine and that kind of thing really want to think twice about strength training, because the mobility that they are developing with golf, and if they have the type of collagen that allows the fibers to delaminate and give them a bit more mobility, it's the kiss of death now if they get too strong with the weights being too heavy, because the architecture of the disc is the collagen fibers form a ring around the nucleus, and the nucleus is a gel. That gel being fluid and pressurized during weight exercises are seeking the weakest part of the wall in the annulus, and they will seep through where the delaminations are, leading to the disc bulge that so many golfers know what I'm talking about. And then the cascade starts. If a disc bulge occurs, consider letting a little bit of air out of your car tire. It bulges on the road, but now your car is a little bit more sloppy driving it on the road. Well, the disc loosens up, and it's called joint instability. And again, the cascade is not only anatomic, it's also neurological. When the brain sees or feels the slight micro movements that are occurring in a shear mode with golf and, shall we say, poor form weight training, the brain has inhibitory loops that get triggered, and the brain will shut down those the power. So consider if you've damaged your knee ligaments, as an example, and the person walks down the stairs and their leg gives way. Well, nothing broke or gave way. The brain shut off the neural drive for that instant in time, and they collapsed. So that's an example of what we call neurogenic inhibition because of unstable behavior being perceived at the knee. The spine is exactly the same way. So golfers will experience in those episodes of back pain when they get a flare-up and these neurogenic loops form, They will feel a real tightness forming, typically, not in everybody, but it's typical that they will feel a facilitation, a neurogenic facilitation in the psoas muscle, in the front of the hip. So when they've been sitting down and standing up after a meal at a restaurant, for example, it's hard for them to pull their hips through. And then they want to stretch their hip flexors, rather than realizing that was a neurological response to the pain, and they should be looking at that as the intervention rather than just more hip stretching. And the other major inhibition would be to the gluteals. So the brain will inhibit the gluteals, which again is the kiss of death for a golfer, in that if they are an external rotator, and that's the primary source of their power in the pulse just before ball impact, they've lost that power. So you can imagine if you were cracking the whip, cracking the bull whip, it isn't the person who has the biggest hand motion on the handle of the whip that gets the best crack. It's the person who has controlled stiffness and can snap the handle and time it so that the coil unfolds down the whip and really creates a wonderful unleash of the elastic recoiling energy. So there's a little bit of a start, I suppose, into really tuning this system elastically, neurologically, taking advantage of the anatomy, and tuning the strategy on how that pulse is created. We can go there if you like. But,
the pulse you had mentioned, the glutes perform a trail hip glute, or the trail side glute is a big pulsar. I would have to imagine is the lumbar spine has limited rotational capacity, a couple degrees at most.
Well, it is and it isn't. It depends on the thickness of the spine.
Okay.
So the more slender skeleton will allow much more range of motion in that storage of elastic energy than a thicker spine. And it also depends on the facet angle that I mentioned, even width of the hips, and the architecture, the ball and socket architecture of the hip joint, which follows a very large spectrum. Some, it's very difficult to find a excellent golfer who doesn't have fabulous internal external mobility of the hip. Can they deep squat? Does it matter? Not really.
The reason one of the pulsing, I'm just curious, is while it's moving. This might be, you might think, well, this is a dumb question. I hope not. But as the pulsing happens, and it happens as you get closer, and then to impact, the neurological message goes very quickly, and then the muscles activate very quickly. Along the muscles that go along the spine and then the deeper it goes, are they being engaged more as your golfer gets closer to impact?
Yes.
It's stabilizing. In my own mind, I would think that the lumbar spine's muscular stabilizers are going to stabilize. The impulse is going to be much stronger, and then as you work its way up the spine, it will not be as strong, as the spine is meant to rotate the higher you go as a whole. Am I on the right track there?
Yeah, but there's a spectrum in that. There are some very fluid golfers, and you can see this in the kinematics of the golf swing. As they approach ball impact, the hips continue through the arc of motion without much of a angular speed change. But the real pulsars, you will see the hips really slow down as that glute stiffens, which starts the whip through the spine, through to the shoulders, to the arms, and depending on how much energy is stored in the club shaft, ideally you want to uncork the energy from the club shaft. It's called the kick, as you know, and that should occur just prior to ball impact. Mm-hmm. So that whole sequencing, now it depends. How long is the person's spine? What's their torso to leg length ratio? How strong is the fascial architecture around all the muscles that act as that tensegrity network to turn all the muscles into a singular muscle, if that makes sense in my description. But you will see the beginning of the pulse that really is dominant in the trailing glute. If you shoot right, it'll be in the right glute, and you will see that pulse continue up through the spine, into the shoulders, down to the arms, and even on the hand grip. Now, having said that, when we look at the spectrum of the pulse creation, different golfers have different strategies. So I've mentioned the right trailing hip. That's very typical of the type of golfer who gets the transmission into the ground of that pulse. It'll be external rotation of the right foot if they're shooting right. Mm-hmm. So those are the golfers who say, if you will allow me 12-inch golf spikes, I will take them. And we measure tremendous ripping force of the upper of the shoe away from the sole. And we all know golfers who that is their primary pulse production genesis.
I tell you, not to interrupt you, but because you're a Canadian and a hockey guy, I mentioned who I used to play with here locally when he still lived here, but when I was playing, traveling around and doing Monday qualifiers and things, I was going to Detroit, as my family is, to do the Buick Open. I got there a few days early to do the pre-qualifier and the qualifier, and he said, well, I have this friend that plays for the Red Wings, Joey Kosher. He said, I'll give you his number, you call him, keep your mind sharp when you have a few days off. Well, I met Joey and we got to play, and I don't know if you know Joey's build, but he's built like a bulldog. I mean, he's one of the He has no knuckles left because he's used them so much on people's faces and helmets. But he told me, because after we were swinging, I said, you put a pretty good torque on those shoes. He said, yeah, I go through about 3 pair a year.
Yeah.
That he would blow his shoe out.
Right.
Because he was torquing so hard. Not
Yes.
not to interrupt, but I thought you would find that kind of interesting.
Well, it's amazing how many great professional hockey players, their passion is golf. Mm-hmm. And when you look at the mechanics of cutting V's on the ice to accelerate, it develops tremendous external rotation horsepower. And when we talk about training, that becomes a real training target for some people who completely neglect the external rotation power in the hip in their golf training. Anyway, just to finish off that idea of those who are on the spectrum of using external rotation as the driver of the pulse, the other end of the spectrum are what we call the leapers. So when we have those golfers on force plates, we actually see they leap, and we both know of some famous golfers who actually leave the ground, and that is their upward thrust through the hips that adds that stiffness, slows the hips down in a transverse rotational sense, and really propels the transmission of the pulse up through the spine to the eventually to the club.
There's much discussion, maybe not much anymore, but in the golf coaching world, I know Jim McLean had a post of Jack Nicklaus's swing the other day where the argument is, should people keep their rear end, let's say if there's an imaginary wall back there, should they keep the rear end, one of the glutes on the wall the entire swing, and the other is early extension, which is what I think TPI kind of coined that phrase. The early extension is a bad thing, but even though everybody extends in the swing, but to go to your point on the verticals, people who have very, very high verticals, when you look at ground reaction forces, have more of an extension at that point. But Jim had posted a picture of Jack Nicklaus and even Rory McIlroy where their rear end came off of the plane that was behind them, closer to the ball. Didn't early extend, but it came in towards the ball. And I don't know Rory's numbers, but I have to imagine Jack Nicklaus had some pretty serious verticals, given how high he hit the ball and how straight and everything else. But it just shows that people are going to do what their body allows them to do, or the way that, as you said, that they're built, their natural biological structure. You're going to swing in a particular way, and if you try to change that, you're a recipe for disaster. The timer starts ticking on how soon that's going to blow up on them.
Well, I don't know if you want to comment on that or not, but if you would, it gets back to that idea of the great coaches, in my view, are the ones who recognize the spectrum of the athlete that's in front of them and how best to pull out that performance and resilience from what that person is showing them. And yet there are other golf coaches, and I would hazard a guess and say, well, it's not a guess, it's my experience, that they know what the perfect golf swing is because they've studied Jack Nicklaus or you name the golfer, and this is the way everyone should golf. Well, give them 3 golfers. One will suit that particular mechanic, shall we say, and they'll do very well. And they will build their name on that one golfer. One golfer it makes no difference on, and the third golfer is a patient who we will be seeing.
It's only a matter of time.
It's only a matter of time. So that's I will say that of every pro golfer that I've seen, somewhere there was a golf coach that they got involved with who created stress concentrations in their body that didn't suit them. And that was their demise.
I'd like to take a brief break to acknowledge one of our affiliates. As many of you know, one of the questions that I ask at the end in our Emergency 9 is what book is our guest reading or is currently on their nightstand? And I want to make you aware of a couple books that you might not have heard of yet, and they are most needed in today's world where our communities, our states, our nation, and our world are lacking in significant leadership. Someone to take the reins and be the beacon of light for what everybody can benefit from. And that comes in the form of 2 books. One of them is Why Do We Call Them Leaders? The Disgraceful Collapse of America's Leadership Standards. And the other one is called Leader Shit, S-H-I-T. Look at the broken systems in corporate America that allow leaders to be really good at being bad. Both of them are written by Randy Soma and is an insider look behind the curtain in the corporate world and the rest of our society to illustrate what a lack of leadership will eventually lead to. You can get both of these books by clicking the link in the summary of this episode or by going to find them on Amazon.com. I see it a lot, or I do. You know, I know plenty of, well, myself probably being one example, but a number of friends who showed all the promise in the world and had switched coaches for one reason or another and started doing something different. And then all of a sudden, even after some success, all of a sudden, not just the game went sideways, but the body could not. They were injured like repetitively over and over and over. And as many golfers know, injury in golf it's bad and it's painful, but it's not debilitating early on. It gradually builds over time, and golfers are so notorious, maybe passionate for trying to play through it through medication, or they go to physical therapy and they don't take the time to do so I hope we get into a little later, the virtual surgery that they try to play through it, and unknowingly only making the problem worse because they're doing something that their body is not conducive to doing.
Right.
Golf itself, I want to get into a little bit about measuring, sequencing, patterning, etc. We talked a little bit about pulsing, but can you go into your measuring and the muscular sequencing, as you touched on a little bit, but as far as the swing is concerned, can you describe that a little bit and what your data research over so many decades have shown?
Right. Well, as I said at the outset, when I was a young professor 45 years ago now, my only question was, how does the spine work for everybody? Mm-hmm. And we developed the first laboratory which was designed to understand the internal stress distribution of a person doing anything. But the technique had to be sensitive to the individual strategies that the person employed. So you could just watch someone in a factory. You know, there were studies being done at that time by my colleagues at the university of people who built cars on the GM assembly line. How come some had back pain sufficient that they missed days off work every year because of acute back pain, and yet there were other colleagues who would get through their whole career without debilitating back pain? Mm. What was the difference between them? And it wasn't random. It was those who created stress concentrations in their back. So when they bent down to pick up a car door to mount on a Camaro going by the assembly line every 52 seconds, they lifted with their backs. The person who never had a problem lifted with their hips. Now that might sound strange to people because most people are thinking that, well, you lift with your legs. Not necessarily. It's called a hip hinge, which you're familiar with.
Unfortunately, after 30 years of training, it took until Brian Carroll actually showed me how to hip hinge. And I'm like, that's it? I've been doing it wrong the whole time. I've been listening to the lift with your legs and all this, and probably doing damage to myself unknowingly.
Yeah.
But it's...
And we studied police officers for 5 years. We studied military groups, athletic teams, firefighters was an extensive study we did in Pensacola with the Pensacola Fire Department. Those who had repeated episodes of disabling back pain created stress concentrations at the site where the pain was the greatest. Now, that would have been exacerbated by other issues that they had. Maybe they were favoring a damaged knee, or they had so-called restricted hips or tight hips as they're known, or who knows what. But a very thorough assessment, getting back to the science, will reveal where these stress concentrations are. So our instrumentation used electromyography to measure the muscle activation profiles that the person, if you think about it, they chose to use that pattern. Well, no, they didn't consciously think about it, but that was their, it's called an engram. So you don't think to activate your quadricep or your shoulder muscle or anything when you're walking. You are running a movement tape. And it's those movement tapes that repeat that stress concentration over and over again. If it's appropriate, the person will probably have a good life. If it's maladaptive, either through learning or that's just the way they do it. You know, I used to watch my kids play sports, and sometimes I'd forget my eyeglasses, and I couldn't read the numbers on the players' jerseys, but I knew who every player was by how they moved, and they all had their movement signatures. Anyway, we would measure people and their stress concentrations, and we learned that would give us very big clues as to where they were eventually going to break down. The next laboratory we built was a spine cadaver laboratory. So we had a few humans, but we couldn't get too many volunteers to, donate their spines. So we used a lot of animal spines. As it turned out, a pig neck mimics a human lumbar spine very closely. In fact, if I handed a human spine surgeon, a pig C4, C5 joint, I would have to tell them that that's not human.
That's
for them.
Amazing.
Yeah.
The spine, the heart, the valves in the heart, which I know are replaced
from
cadavers.
Pigs. Yes,
it's amazing. I don't want the pig skin as we have or football. I don't want to say it, but there was something else that very closely resembled human.
Yeah, well, a lot of the digestive enzymes are similar, which isn't my area. However, that one particular, and when you think about it, the layperson says, well, the pig's a quadruped. How can that be close to a human spine? But a human neck just has to support the weight of the head, so it's a slender, highly mobile architecture. The lumbar spine has to support the whole weight of the body, plus whatever you're lifting, etc. Well, a pig is a rooting animal. They root for food, and they have a very strong lumbar spine in their neck. It's not very mobile. So when you match form to function that way, it makes sense that they have a lumbar spine equivalent in their neck. But anyway, what we would do is we would get 50 identical pigs, and we would load those spines and match very specific loading regimens, lots of motion or lots of load or rate of load, repetition of load, and we would observe what injuries occurred. So we became educated. What really does cause a herniated disc or an end plate fracture or spondylolisthesis or whatever the case may be? The next laboratory we built was an imaging lab. We had micro CT for example, what's known as a CAT scan, plain film, X-rays, ultrasound imaging, etc. So when a patient came in, we would be able to much better interpret the specific anatomical changes that the radiologists were reporting, but didn't know the original mechanism. So, I'd be asked to be an expert witness on a court case. Here's an individual. This is what their MRIs showed. Is that consistent with the alleged scenario, being it could have been a crime or, someone at fault, or negligent being the criminal or legal foundation of the case. And then my dean came to me and said, okay, hotshot, you're doing all this science, and now you're seeing a few patients. Why don't you start a experimental research clinic at the university? And the unique thing about that was I didn't have to follow the restrictions of a traditional medical model. People came in, and I set aside 2 hours for the first assessment. Well, my medical colleagues would look at me and say, 2 hours? What are you going to do with a back pain person for 2 hours? And do you know, Pete, after the first year, that went to 3 hours. And we learned to talk to the person and say, tell us your story. And they would reveal all kinds of things that the traditional medical approach never found out. What were the impediments that guaranteed their failure with the 10 previous clinicians that they'd seen? If we can't deal with those identified impediments, we will fail too. So those impediments could be they do their very good exercises or whatever the intervention is, and then they go and sit and watch TV on a very floppy couch at night, not realizing that their hips are being bent past what the joints will support, bending their spine, increasing the size of their disc bulge. And when the exercises and how they were moving throughout the day was actually helping. So they were undoing. Anyway, we would learn these kinds of things, and then we would say to them, let's say they were an athlete, I would say, okay, I see your training program, and I would look at the training program, and I couldn't see a consistent philosophy. The coach and the trainer was just throwing the kitchen sink at it, doing exercises. Well, that doesn't work in a spine that's already compromised because it's in pain. And I would say, what if I could give you one athleticism, what would that be to really help you to be resilient and get back to the game you love, or the game that you're making many millions of dollars to play? And sometimes they would say, well, I'm going to have to think about that. And I would say, stop, fire your coach. And they say, what? And I said, do you mean to tell me your coach hasn't identified what you need the most, and that is now the target of your training? And that hit them like a ton of bricks. So the efficiency of training is very important because the person has reduced training capacity. They're hurt. So that was a whole nother layer that came from the experimental research clinic, and two more. We call these the 6 pillars of our science. The fifth pillar were epidemiological studies. Injuries form clusters that are very revealing. Why do gymnasts have a very high rate of spondylolisthesis? Why do many senior golfers have, I hate the word degenerated discs, but shall we say flattened, compromised discs at the bottom of the thoracic spine and the top of the lumbar, the thoracolumbar junction?
That's very interesting.
Yeah. Why do some get a certain type of disc bulge that is a very focal disc bulge versus a disc tear or a delamination? And I know we were talking about that earlier. And then the final pillar was we ran clinical trials. So is what we were converging upon truthful and effective? So we would then take different groups and train them. So I can tell you exactly what our score is clinically. I can tell you exactly if a person comes in with extension intolerance from facet arthritis, I know how many of them after 2 years in a follow-up would say, I am happy now. I am at a place in my life. I'm not 16 again, but I can do the things that I want to do as long as I follow the new rules. So following back injury, the rules change a little bit. And, an athlete will say, but I just want to get, or a golfer. There's someone here at Hilton Head will say, well, I just want to get back to playing golf again 5 days a week. And I'll say, yeah, you could have done that when you were 21, but you cannot now. And you're going to have a graded recovery, allowing your body to adapt. I don't think you can go play 2 rounds of golf 5 days a week. That's not going to work out well. You've gone right back to the mechanism that caused you to get into this condition in the first place. But would you settle for 2 or 3 games of golf that doesn't leave you painful afterwards? And that is doable if you want to make that concession and follow these new rules. Here's a plan to roll that out. Anyway, that was the 6 pillars of our science and how we converge on many of the opinions that I currently have, and how we organize our training. And I know we had a talk about this in the morning. There's so many people on the internet who have no idea about what they do, and they think, oh, well, McGill works on pig spines or something. And when you look at our published literature, it's not even 10%.
I think that is something that is grossly lost or misinterpreted when you look online or you talk to people. So I talk to a lot of them, and any critics of your work, it is often taken out of context, or it's a snippet or a soundbite of something. And I think that the biggest thing that people miss when they discuss your work versus fill in the blank of someone who might have a different opinion is your work is very often dealing with athletes or individuals, everyday people who come to you who are already injured and they're in pain. And some of these other coaches, or again, another fill in the blank person who might disagree with you, is usually working with people who are just out of shape, or athletes who have not been injured, and they need to get them to go from being a Division I to professional, or professional journeyman to top tier, or top tier to one of the top in the world. And there's a major difference in that when you're dealing with somebody who's injured, as someone who has experienced injury, I didn't get to the PGA Tour, but I played at a very high level. I mean, there's razor-thin margins, but it's a world of difference. But when you're dealing with injury versus something that's just out of shape, or has had a layoff for any multitude of reasons, that is a completely different animal than working with an athlete who has not ever been hurt, and what you're allowed to do with them versus what you have to sacrifice to get them to be able to play again. There's only so many Brian Carrolls in the world, and I would say that there's a lot less of them than there are the latter, where you can take an injured person, a broken vertebrae, a cracked vertebrae, and get them back to world elite level. I think you were even surprised in talking to Brian and reading Gift of Injury and listening to the entire story as you were on his show. But that is not the norm, and people who have that expectation, whether they call you or they call the Ben Shear or somebody at that level, to have significant damage from a car wreck or lifting incorrectly or a lifetime of wear and tear, to think that even though you're world experts in your field and have helped many people, that to take someone at that amount of damage and get them back to playing at a high level like that, the body can't take that anymore. It's been broken. To fix it, to get back to enjoying it, I think people's expectation needs to be changed, and people's understanding of your work, career's worth of work, is largely been with, or at least what's been out to the masses, has largely been with people who are injured versus others who might disagree with you, or with athletes who have not been injured. Big difference.
Well, people only come to me and are trained clinicians because they have back pain. That's the only reason. But I should point out, when we are dealing with an elite athlete or an individual who has aspirations of being an elite athlete, I usually work with experts in that particular sport or endeavor if it's not a sport. For example, if we take golf, there are quite a number of players active on the tour now where I saw them and they came to see me primarily for their back pain. So my job was to get them out of these repeated acute episodes, which they thought they had chronic back pain. In fact, they didn't. They had mini acute insults to their back, unbeknownst to them throughout the day and throughout the week, that kept them in chronic pain. But the mechanism was not chronic. The mechanism was mini acute. Anyway, my job was to get them out of that pain, which has several stages, assess them, then get rid of the mini acute insults to their back in whatever strategy we're going to use, and then build a resilient foundation to move.
What would be an example of an acute insult in somebody's back?
Okay, let's say they had a posterior disc bulge that we would measure if they sat down on a floppy couch or in a chair and slouched. The bulge would grow and they would say, oh, my back pain is increasing, or my left toe is going numb, or whatever the sign is. But going for a walk takes my pain away. So if we're dealing with that person, unbeknownst to them, you cannot sit on that floppy couch anymore. You're going to need a more firm, supportive chair with a lumbar support. And now you've just created a capacity to go and train without pain. But until you do that behavior, you're going to be in pain. And rather than what they have been doing, which was to take a analgesic drug and then go and hit more balls again.
Guilty as charged.
Right. So that's my role, to build a base athleticism and resilience. But then I turn them over to the many expert coaches who are in my circle around the world. So in golf, I would send them, you've had Ben Shear on your podcast, or Clayton Skaggs in St. Louis, who has, he was set up in Jupiter for a while and had access to some of the great ones there. But someone like Ben or Clayton will then take that athlete and do the fine-tuning to tune their body to really express their athleticism at a high level. So they'll strategically work on mobility. It might be hip mobility, it might be knee, shoulder. They'll work a little bit more on very sport-specific timing, and no doubt stability. So that tuning of the mobility stability spectrum. And so, I have my coaches, if they want to get back in the NHL for hockey or NFL football or world-class rowing, mixed martial arts. Got quite a few athletes in the combat sports, etc. So I have my coaches that I've worked with in the past, I have great confidence in, and we compare notes. So I don't want to say I'm the guy who gets them back on the tour, but I play the first half.
Yeah,
of the role.
The first step. If they're in step 3 and want to get back to step 5, it's like, hey, wait a second, you might need to go back to step 1,
right?
Or even step negative, and we got to, because if you don't fix this, you're going to be back here again in 6 months, 9 months, a year, and you're going to waste all that time and possibly do more damage.
Yeah, and the humbleness of those great coaches is important as well, because if things aren't progressing at their high end tuning or training, shall we say, they're humble enough to say, oh yeah, you better go see McGill or one of the McGill, whatever, just to reestablish that base pain-free resilience again, and then come back. And that's a beautiful partnership.
Mm-hmm. Yeah, especially at that level, because you see so many people who achieve a certain level, and that is their beacon, achieving that level to get the notoriety, and they don't have the commitment to I think they all start out with wanting to help people, but some people might get there's a divergent that they maybe get a little addicted to the acclaim that they're receiving and the notoriety, and it's just another enemy along your journey in life, that the enemy becomes maybe a little addiction or a dopamine hit when someone tells you how good you are. And the higher you go, at least I noticed, because again, I did not get to the elite level on the PJ Tour. I got pretty high. I was Player of the Year here in Hilton Head, little area, but it's still an accomplishment that I like to. It's up on my wall. It's hidden, but I know it. But when people start telling you how good you are, it's very easy to fall into wanting to hear that over and over again, and you lose sight of what got you in your field to begin with. In this case, helping somebody, and it is very unique. And that's why there's so many that are at that level, because they've climbed that mountain. And maybe if they got veered off a little bit, somebody got them back on track to say, you're drifting, you need to get back. Or they caught themselves and they said, this is not what I want. I want to help. This is my sole purpose and the thing that drives me. I want to get back to helping people. I know one therapist that we discussed earlier that I had worked with for some time. He left a certain world-class golfer, and his reasoning was, I'd been to his house every day for 6 days a week at minimum for 3 years. And he said, my purpose was I want to get back to helping the masses and not just focus on a certain individual that required that type of attention. So I told that person we had to part ways, and I did what I could do, and he was going to need to go on his own. We remained friends, but his professional career, he wanted to get back to helping people. Didn't mean to get off on a tangent.
Well, I know I often say to athletes, I hope I never see you again.
Yeah, it's a good problem to have.
And that then I know I've done my job. However, if they want to send me tickets to the Super Bowl or whatever it is, there was one year, 2 or 3 years ago, where we had an athlete in the Super Bowl, an athlete in the World Series, and 2 in the Stanley Cup.
Wow.
And then I thought, this is, and you know, Pete, I'm not a sport fan. That's my daily job, but all I want to do is watch it for 10 minutes, watch them move and perform well and not get hurt. And then I just as soon go out to my shop and weld a pipe or something.
Now, if they were in the snowmobile world championships, I would have to imagine that you would want to be out.
Oh, you've heard about that?
Yes.
Yeah, I do have a little bit of a passion for hot sleds.
Yeah. See, I'd like to take some professionalism that I'd like to do my homework when somebody's on, regardless of how well known they are. I'd like to find something that they're passionate about that might not be known to the masses. If we could discuss training, in particular in golf, as strength training has come to the forefront. I think there's some golfers Bryson DeChambeau really brought to the forefront in the last couple of years. Golfers have always trained. You go back to Gary Player in the 50s and 60s and 70s. But I think when Tiger came along, he really made it popular to the masses based off how he changed his body type. And then Bryson has taken it to a whole new level as far as the strength training and mass and swing speed. And the common thought process in the golf coaching world, even with some of the trainers that are out there, who seem to be very good, maybe they're not doing the best service to the golfers, is that if you become stronger, not necessarily putting on mass, but become stronger, then the neurological system, as we discussed earlier, which I'm thinking there may be skewed in their vision after listening to what you said, but the general consensus is that if the brain senses that the body is stronger and it can hold position better, that it relaxes the governor on the body's ability to move faster. But in studying your work, stronger doesn't necessarily equate to being able to move faster. So I wanted to get in a little bit of that and to just add more on that, which you're probably never supposed to do when asking questions, is in particular the Olympic style lifting, as that has become very, very prevalent, I would say, over the past 15 to 20 years at the pro level, at the Division I level, and it leaches down junior golf. And you see kids 13, 14, 15 doing these type of lifts, deadlifts, squats. I don't know if they're doing clean and jerks and things like that. But even going down, if you go, as I travel around, and even in this area, some of the private clubs or some of the gyms where the trainers are, you see people who play golf because we're island that's 40,000 people. It's like a big university. Retirees training in these Olympic-style lifts. And I know that in studying your work and listening to you in other podcasts, that is often not the best recipe for golfers in particular, as you mentioned pliability earlier. That's a lot packed in.
It is. That's a huge question, and I'm wondering what is the most logical start on putting together. I mean, it requires an essay to answer it. Well, let me start this way. I think strength is popular among coaches and trainers somewhat because it's the easiest thing you can measure and build quickly in an athlete. But when I measure some of the hardest strikers in MMA, which I have done, when you find a person with very large muscles and they look very impressive, and when you measure their punches and the kinematics that they use to create the punch, they're pushing their punches with these big muscles. But when you find someone who doesn't look very bulky, they snap the punches. So if you can imagine this, and I'll try and draw a visual image for the listeners, I could push an object with muscle very slowly, or I can bend my fingers back, load them elastically, and snap them. That's the difference between someone who really hits hard. So as we measured we measured 5 top UFC combat athletes. They created what we called the double pulse. So they would be in stand-up guard position. They would create a pulse turning about the trailing toe and ankle in the ground, and they would create a thrust line through their body so that force was directed up through the leg, through the core, and with the shoulder turning, they would get an inline thrust line all the way, and then just at impact, or the millisecond before impact, they had a second pulse where they turned their body to stiffened granite. In other words, every muscle became an agonist in that fascial bag, shall we say. You'd rather be hit by a Honda than to be hit by a welterweight who knows how to strike hard. So it's a real education for people. So now I can use the same analogy for golf. The bigger the muscle, the more the club is pushed, when the real determinant of that performance is a pulse to create the stiffness at ball impact, to transmit the pulse usually generated at the hips and propagated down to the ground to create an anchor point, and propagated up through the spine to not to be completely flaccid, but not to be overly stiffened either. It's that beautiful, magical amount of stiffness. F equals Kx. K is the stiffness. X is the deformation in that elastic tissue to create the highest pulse. And now shorten up the time of the pulse. Activate the muscles faster and deactivate them faster. When we measured the top UFC fighters, 3 of them had fought for their championship at their weight division. So these were top people in the world. They relaxed their muscles 6 times faster than the graduate students in the laboratory, who are supposedly the average of the human spectrum. That is astounding. So that's what allows them to create a high closing velocity of the fist to the opponent, taking the muscle right down to almost 0 K, because the activation created both force and stiffness. But then at the instant, just before contact, the activation of the muscle, allowing that stiffness. And we see it in guys who hit home runs in baseball. That instant before the ball hits the bat, they pulse through the core, the hips and the chest are aligned, and the rotation is through the shoulders and the hip joints, not so much through the spine. Of course, once the ball has been struck, now the relaxation occurs to allow follow through. So it's the same as in golf. It's somewhat the same as in tennis. It's somewhat the same as in shooting a slap shot. So the neurology of many aspects of hockey parallels golf. So is this strength? We were talking about a great NHL player before the podcast who was a resident here, and there were, whenever I have a great athlete who's an old timer like myself, I say to them, well, who did you really hate playing in the NHL? Not because they were a dirty player, but because they were so dominant, and if you went into the corner with them to dig out a puck, you knew you were going to get hurt.
You were going to pay the price.
That's right. And it was exactly the same pulsing neurology. When you hit that person, it was granite. But leading up to the speed of coming in before the collision, they were loose.
You're not going to get speed with muscle activation.
No.
You have to have that, maybe a little bit of activation to get it going.
That's right.
But it's to me, it's like a wave that builds, and then all of a sudden that wave crashes into something, and then it's gone.
We spoke earlier about, what's this great attraction to golf when, I find it terribly frustrating, but there's that one shot in 100 when you weren't thinking, you weren't trying, and you uncork the ball. It's true and long. It's the best feeling. Now, why can't I do it for the other 99 shots? Well, that's obviously the tour players do it for 97 out of 100 shots, shall we say. And they've just got that grooved in of only trying a sufficient level. Whereas a duffer like me, I try and hit a long ball and it never works because of this stiffness.
I call that in half for some time efficiency of motion.
Right.
That you're and that you in your video that I highly recommend. I'll have a link to it in the summary with Lee, the female long drive champion. Yes. Yeah. You talk about that energy leaks in the swing.
Right.
That was very good.
Yeah. So you'll see in there we actually give demonstrations of a lot of drills that are strength pulse drills. So yes, you need a base strength. Right? But after that, you will get more bang for the buck in your training of creating faster onset and offset. Now let's go to all our strength coach friends, and you tell me how many of them emphasize the rate of muscle onset and offset. And it's almost zero.
I had not really heard of that until pulsing I had heard of because I talked to Ben about it, and obviously listening to your information. There is a Dr. Tyler Standiford is a biomechanist professor at Utah. I don't remember the university, but he was on the show last month, and he's doing a lot of work with ground reaction forces with Smart to Move company. And the old, going back to you're very familiar with the Russian training models and Bulgarians back to the 20s from last.
Very familiar.
Yes. So the old eccentric model was you would do roughly a 10-second eccentric lowering of the weight. For, let's say, a bench press, you're going to lower it for people who might not understand eccentric versus concentric. But what Dr. Standiford is finding out with the ground force models and the ability to measure that is a 1-second eccentric loading and deloading is proving to be far superior to anyone who might come in and say, well, I'm going to do a 10-second. He said, no, it's 1 second. Now, we didn't get into a lot of that when he came on. Our discussion revolved mostly around his work with that, but we did touch on that. And the pulsing, that was the first time I had really heard of it. And then Ben came on, I think, a week or two after I asked him about it, and he'd explained pulsing. But and then obviously your work has been dealing with that, discussing that for many, many years. Should be out there more, in my opinion. Hopefully this will play some sort of role.
In terms of payoff, and you talk about efficient training, here's an example. If I held out a dowel, a stick of 3 feet long, and then I would say to the golfer, hover your hands over the stick, and you look at me in the eyes, and I'm going to drop the stick, and you have to grab the stick before it goes down too much. Now it's falling at 1G, 9.8 meters per second squared. Do you think any amount of strength training will increase the ability of that golfer to snatch the stick. It will almost always make them worse. So what we do is relaxation
Slower.
training.
Actually makes them slower.
It does make them slower because of the stiffening action of the muscle. So we give them relaxation drills. We give them pulse drills. It might be just simply holding the breath with a power breath. If that audible sound that I just did on the mic, I relaxed, I built a little bit of pressure in my mouth, and then I just let it go. Now, speed it up. Even faster. Can I get relaxed standing and put a twitch through my body and focus on relaxing it even faster? Can we get them to lay on the ground in a ball address kind of a posture and just twitch their arm and leg behind a stiffened core? Now, I will say to some people, do a really fast chin-up. And what they do is they try and use so much muscle force, they're slow. They can hardly do a fast push-up, a chin-up, pardon me. But when they learn the magic of stiffening the core, centrating the shoulders, and then pulsing as quick as they can to create the chin-up.
Yeah, your Brian's page, I think, had when
Right.
you were working with him on that. And at his size, the speed at which he
Well,
did
people
that.
think...
He's a freak of nature, too.
Well, he is, but every power lifter I've worked with, and probably 40 world records in powerlifting come from people I've worked with. All of them post-injury, shall I say, as well, because that's what led them
that's how
to
you
me.
met
Yeah,
them.
yeah. And people think the power lifters, I've heard the term, they're the dump trucks of the athletic world. I will so disagree on that. Every world-class power lifter has a very fast twitch strength neurology. So if they're not picking up 1,000 pounds, they're very, very quick. But they're using that fast twitch, large fiber, strength dominant, very fatigable. They're not.
That was, if I can ask you, because I think that is somewhat of where the basis of some of the trainers in the golfing world are coming from, and that I agreed with, because I didn't study under him. I studied a lot of his information, was Charles Poliquin 15 years ago. When the economy was in the tank, I had nothing else to do but read. I don't like to watch TV. It's very toxic. I learned that a long time ago, so I would read Paul Chek's information, Charles Poliquin's information. In fact, I learned about Poliquin through the Chek system. They were, I guess, very close at one time. But the amount of, this was the theory I adhered to, and I started hitting it longer, but then as I look back and as I got into your information, that the heavier lifting, the neural drive I found increased for as you just mentioned. So the ability to push 90 to 105 pound dumbbells in a chest press. I was moving it slow, but for listeners out there, I'm not telling you anything you don't know, of course. But the neural drive to push that was off the charts. And then the transference into the golf swing, I think that the common thought was your neural drive is going to be very high. Now put a 290 gram driver head and a 65 gram shaft and a 20-some gram grip. And now you're going to move that, and you have that neural impulse to move faster. So I think that's where at least it's my theory, that's where the thought process from the training side came from, that if you can increase your neural drive by lifting heavy, you're going to swing faster. But what I don't think anybody really understood was, if you're going to do that, maybe do it in short periods of time as far as training. But you're not going to do it over a gradual period of time, because as your work illustrates over decades, you're going to damage the body. You're not going to make it pliable anymore. You're going to make it it's going to snap.
Well, certainly the joints are going to wear a little bit. Now, then we get into the discussion, loading a joint, is it good or bad? It can be either. It's governed by a thing called the tipping point. So if you're under the tipping point and with sufficient rest, the joints will become more resilient. But if you cross the tipping point, either through too much load, too much motion, or too much volume of training without rest, you'll cross the tipping point, and now the system becomes catabolic for the joint rather than anabolic.
Yeah, and golfers, regardless of level, they're so, I'll use passionate as the word.
Yeah, no, I know.
If they're going to do a heavy training program, let's just say it's going to be a 4 to 6 week program. they're not going to take time off of swinging a golf club, which is going to work to their detriment as far as their body's recovery and their ability to be healthy. And then they're undoing any benefit that they're getting, which is going to lead to delamination. It's going to lead all this whole list of issues that you've discussed today.
Can I use an analogy to illustrate that from
yes,
the world of track and field? Okay, let's look at the typical training cycle of a world-class sprinter. Now, I know there are a few freaks of nature that don't follow this rule, but most world-class, fastest men and women in the world, and I've worked with a few, this is what works. The first phase is strength, and they will squat heavy and create this wonderful strength base, not really worrying about speed, and they sure as heck aren't sprinting fast. And they'll come out of that strength phase with a rear end as wide as this table, and you look at them and you'll say, you're the fastest woman in the world? Or you're the fastest man in the world? You know, it's mind-boggling the first time you work through this periodized program. And then starts the neurological taper. They have the strength foundation. It's no longer the emphasis. It now goes into neurology. So it's over speed running downhill, more speed, more on and off, more core stability, and faster hips, faster shoulders. Then you taper down where you start to relax the hands and the face and the jaw. There's many sprinters who don't breathe for the 100 meters.
That's amazing.
That is to lock down the core, because every core motion could be an energy leak. So the muscles that cross the hips, which is the centroid, the powerhouse, shall we speak, they cross the hips into the core, and they cross the hips into the femur. Well, the whole goal of it is to propel the femur even faster, but it's the same muscle that goes into the core. If part of that muscle activation is bending the core, that's a waste. The core should be locked, so 100% of that muscle action goes distally to the leg. So you see why they slow down. And then there are all of these neurological tricks to become faster with pulse onset and offset, more mobile through the hips, more core strategic stiffness, etc., etc., etc. The amount of time they spend on the track is interesting in that it's just about zero when they are in the strength phase. And then, of course, the track side. So if golfers could think that way, many of them would do themselves a favor, but the golf season is a much longer season, so it doesn't lend itself to that. Like a sport like hockey or NFL football, it has a
definite off season. And
Right.
I think that's a concern of many of the trainers I've had on, is that the lengthening of the PGA Tour season, where basically used to end in October. Right. Didn't want to compete against football, and then of course it's a summer sport, it's a warm weather sport. So they had off really from mid-October, November, December. If they were in the Tournament of Champions, they played second week of January, but most of the rest of the tour was, so they had 4 months off. And nowadays with the wraparound season, right, there's, you don't know when, and if you're lower on the, you're 125 through 150, and you're getting a call, it's a Sunday night, hey, you're in this week's tournament, get on a plane and fly halfway across the country, because now you're in, we got you in this field, now you got to do that, and it's much more competitive, much more difficult.
Yeah. Anyway, you're starting to, I know you appreciate this, but I hope the listeners are appreciating the considerations of tuning a high-performance resilient athlete. There are many, and I think of I used to travel a lot, and I would go to different track teams around the world, Olympic programs and national programs for different countries. And I'd go in there and I'd do, a little bit of strength training and whatnot. And then we'd get into speed and pulse drills and whatnot. And the coach would say, well, you're doing exactly what we got in Dan Paff. Dan Paff is a sprint coach who has numerous athletes who've created records. And they said, well, Dan showed us exactly the same thing 2 months ago. And I said, well, yeah, exactly.
Why didn't you do it?
Yeah, I mean, he believes in a good, stiffened, controlled core to unleash the power of the hips through the linkage. And, where a linkage, there's only so many ways that you can get it to perform without creating stresses that damage it. So, yeah. Anyway, Dan and I used to laugh about that. But I will say, with the great, since this is golf specific, the golf coaches, and, I've mentioned Ben Shear and Clayton Skaggs and some of these people who just really get it. And we talked about psychology a little bit earlier. Mm-hmm. And it's very hard to convince some athletes that keep doing what you're doing and you will remain in the same pain state. And they are so fearful that they will lose their athleticism by doing whatever the period of that particular training cycle demands to give them a lasting resilience. But once they are convinced, either because they now have been told, well, you're beyond reproach, there's no help, only surgery is going to work for you, and you're going to be half a year off anyway. Mm-hmm. So the psychological game of getting those athletes to listen. And I will say that being a little bit older with white hair probably helps in that regard, and it's going to be harder for a younger person who may be very knowledgeable on how to do this very scientifically organized method.
As the people who might be listening, or they're at home, they watch golf on TV on the weekend, whether they're a collegiate athlete, they want to play professionally, or they're a 20 handicap that just loves to play golf, and they watch some of these tour pros, some of the biggest names in golf, who are doing deadlifts, who are doing squats, and you can see in their physical structure compared to where they were 5-10 years ago how much bigger and stronger they got, and they're hitting balls prodigious distances, I mean, off the charts, and it seems to grow every year. And they look at this thing, and then they listen to an episode like this, and they look at some of your work, and they say, well, so and so is doing this, and they're an elite athlete. The question that, even if they want to believe, because obviously your history and your experience and everything else is proven over time with so many different athletes, the question that I could see running through their mind is there not anywhere within my golf training that I should do some type of heavier lifting at certain points in my training, if they're going to go down, if they want to get into training, they don't want to be a couch potato. And just, if I could add on to that, so for example, take someone, friends of mine, they're 50 plus. They're through the era of the 30 to 50 where they had kids, they had work, they might have been athletes when they were younger. They went through a period where they didn't do much, and now they want to get back into it. So how do you weigh, for somebody who might be listening that fits into that category, the health benefits of bone density, overall health of training, even if it involves some heavy lifting, versus the ability to play golf, in particular, let's say an axial load type exercise? Another loaded question.
Well, again, you've asked a lot of elements.
That could be a whole semester.
Well, can we talk about bone health as a? Can I take that out of the answer Absolutely. First, and we'll come back to that? Absolutely. All right. Okay, golf was transformed 15, 20 years ago with some influential people who started to train quite heavy. They've had not good outcomes in their career. There were some who I've been associated with who were under that influence. They started to get sore backs and sore knees, and they realized in time that this isn't taking them to a place that they want to be, not only in terms of being pain-free, but it really didn't add length to their long shots. So I think people have to be honest with themselves and know what it is they need to be increasing both resilience and performance. So that's a start of that essay. But now the first theme that I think we developed is the spectrum of being human. And if I had I can't give you a blanket answer to that, but
I know you hate generalities.
Yeah, I can't do it. But if I was able to assess that person and determine what it is they needed, what is their current level of fitness? Do they have pain and an injury history? What is their body type for all of the anatomical, neurological, and physiological variables that we mentioned earlier? And then I say, all right, what is the thing that you need the most? And if it turns out that they need to store and recover elastic energy better to bore the ball in a long drive, then they ought to know the answer to that question. And if a deep squat or an Olympic lift will be the best tool, because an exercise is simply a tool to achieve a goal. Mm-hmm. So know the goal and choose the very best. So, and then someone listening to that will say, oh, McGill hates deadlifts and Olympic lifts. I've worked with the top. I'm not against it. I mean, one of the lovely things of Olympic lifting is it teaches pulse, relaxation, pulse sequencing. Imagine an Olympic lift. The person, the lifter, gets into what's called a wedge, a lifter's wedge, grips the bar, and rips it off the ground with a pulse. But it can't be a full-on maximum effort pulse because the muscles become so stiff you couldn't move. It is very much a incredible precision event. And then as the bar comes up, before they, and the bar, gravity's pulling down the bar, so as soon as they get the bar up to about chest height, they finish off with the shrug, and then they have to completely relax to snap under the bar to get into a snatch catch of the bar. So you need a relaxation to get under the bar, because if there's residual stiffness, you won't make it. You'll lose the lift.
You're never going to get there.
And then you've got to snap to get under whether it's 50 pounds or 200 kilo. It's an incredible trick of neurology. How nuts do you have to be to relax as that bar is coming down on you? But you must, and then snatch it with even faster onset. So in that way, you could justify an Olympic lift as a tool for teaching pulse neurology that hopefully transfers to golf. But now I'm going to say that Olympic lifting isn't what everybody should aspire to. Olympic lifting is a sport that finds the athlete. The athlete doesn't find Olympic lifting. It's very, very different. So if you don't have mobile hips that you can hold a bar over your head, so the thrust line is straight down through the shoulders, down through your hips, and down through your knees, your shoulders won't be able to create that thrust line. So where's it going to go? Probably into your back and your knees.
Yeah, and most golfers, the general public, we'll use them because that's probably the majority who's going to listen to this show, as they're sitting for 8-9 hours a day at their desk. They're driving, let's say, an hour to work each way, so there's 2 more hours, so now they're 10 hours a day. They go home, they eat dinner, they're sitting, there's another hour, 11, and they go watch TV in their soft sofa. That's 12, 13 hours a day they're sitting. The kyphotic portion of the thoracic spine, and now you're going to tell them in the gym, even if it's just a big dowel rod, I want you lifting this over your head. And by the way, when you go practice golf, maybe an hour in the evening or an hour or so on the weekend, or you're going to play 4 hours, the default position is to be even more kyphotic as they bend over and get into the golf posture. And now you're going to put, whether it's a dowel rod, long dowel rod, you're going to have them practice these movements, or you're going to just, let's say, well, we'll start you easy. We'll just give you the bar at 45 pounds. They're never going to get their arms extended over their head,
right?
Because they're bent so forward. It's
I will come out and say I don't recommend Olympic lifting as the tool of choice to enhance golf performance and resilience. But let's keep thinking along those lines. I have never seen a golfer do a squat on the golf course. I've never seen a hockey player, unless they're in a tussle on the ice, doing the same thing. But what we do see is incredible hip internal-external rotation. So the hip airplane exercise, which you're familiar with, standing on one leg, keeping the core somewhat controlled, the rib cage and pelvis stay together, and you stand, say, on your left leg, your stance leg, your right leg is stiffened, straightened out behind you, which will greatly increase your balance, and then only through the hip, internally rotate and externally rotate throughout the full range of motion. There would be the beginning of a beautiful hip creaser that translates to golf. Now let's start putting some pulses into that. Let's start getting into what we would call a standing prayer, and quick off the mark, turn left and go, both sides. These are all pulsing drills that translate to golf because of the emphasis on internal and external rotation.
And that's using, in the video that you did with Lee, that's using hips to drive the swing and not spine-driven swing.
Right. It's a beautiful combination of creating a pulse that creates eventually the whip that you're trying to create through the linkage to the hands, to the golf club shaft. So these things have been thought through, and that to me would be a much more golf-specific, transferable tool of choice for training to enhance that with very little risk of crossing the tipping point. So Olympic lifting requires a lot of skill, and hence we've seen, I don't know of any pro golfers who are doing it at the moment. Maybe you do.
No, I don't know.
But it's now off.
I look at those things, and for example, I was scrolling through social media, and there was I think it was the Korean Olympic team, a bunch of young guys. Maybe it was the teen Olympic team, I couldn't tell, but they're younger guys, and they're doing and they're not bulky. They're obviously well built. But what was fascinating to me about them, that got me thinking about this as we were talking when we were going to schedule this, was that they were goofing around in the gym, and they had the 45 and 90-pound plates stacked, and they were probably 4 feet high, I think they started, and they were going from a standstill. They'd squat down and jump up to the top. So the spring-like burst, the pulsing, I guess would be your terminology maybe in that effort, that they could jump that high, evidently because they've trained in Olympic style lifting. And I just ran through my head, like, these guys aren't too bulky and they have explosive power. Could that not be used for golf? But if the risk reward is not there, like the risk is too high for the reward that you're going to get.
Well, I don't know about that. So they're not lifting those plates in a deep squat. They are doing a pulse that is not out of a deep squat. It's a very modest squat.
But the training that I would have to imagine that they're training with deep squats, and all the other training they're doing makes that easier for them to jump up to a 4 foot, 5 foot high stack.
No, I would disagree.
Okay.
Because of my work with some of the best basketball dunkers and training the drill exactly as we're describing it. So the mechanics of that leap, it's not a deep squat leap at all. Now, it really depends, and you with your genetic background, you may appreciate this. I don't know. When you look at a long-legged NBA power forward who, when I sit down beside them, we're the same height. In other words, they have relatively shorter bodies and a longer leg length ratio. They don't do a deep squat. They do a beautiful pulse out of the gluteal muscles, which power the leap into the air. Very short range stiffness spring. It would be the analogy in engineering. There's very little power developed through the ankles. In fact, all I need is a linkage, a stick. But the power of the hips extend the hip, which in turn extend the knee. But they push the heel down into the ground. And when you measure a lot of them, watch them take off from the ground, And there, of course, there's a tiny little bit of push off on the ball of the foot, but the main thrust of the power is through the heel down into the ground. They land on the heel, and the bulk of the power production into the ground is through the heel. The push off through the ankle comes a little bit later, just as they're leaving the ground, for a tiny bit of added value. Now you take a basketball dunker who probably isn't as good a dunker, but they're longer in the body, shorter in the leg, and much heavier in the leg, heavier in the calf and whatnot. And their jump, it's much more of a vertical jump. The forward lean of the body doesn't change that much, but the knees come forward, and it is a leg strength pulse, vertical jump. And so that is a front squat style of strength expression. The longer leg is a hip hinge back squat style. Do you see the difference?
Yes.
So now you start putting some pulse production on
The
that.
mechanics of the physical
Very
structure,
different.
the
Yeah.
length of the femur,
Yeah.
and the ball in the socket of the hip is going to play a role.
Right.
The
So
depth of the hip bend.
Olympic lifting favors a shorter leg, longer torso architecture.
And so golfers, if they're going to employ some of these things, if they want to add some strength, because let's say they want to go from playing once a week to 2-3 times a week, and they know that they haven't done any training, or they're minimally strong as far as overall body strength, and they want to be able to absorb the wear and tear. Maybe they're going to go with friends once a month and on a road trip, 6-7 hours, Pinehurst from here, 5-6 hour drive. They want to be able to absorb the travel and the more play. And if they employed some of these things, it'd be very, very important for them to employ the right one based off of their physical biomechanic structure. Because if they employ the wrong one, they could unravel everything.
Yeah. So I'm not saying avoid squats, but maybe it's just a half squat or a quarter squat that is going to transfer to golf.
I think that's important, because I don't want people, again, going back to some people who are critics of you, that no, you're not an anti-deadlift, you're not an anti-squat, you're not an anti-Olympic lifter. Does it match what the person needs? Is it the medicine that they need?
That's all it is. Is it the best tool to accomplish the goal?
And,
so going
and
back
what form of that exercise are they using, and does it match their physical ability or physical build?
Right. So let's go back to the Korean leapers jumping up onto a stack of plates, or a box, basically. It's a box jump. Olympic lifters are very, very good at that. In fact, I have a metric being that you place the height of the box, the height of the athlete's nipples. And they have to jump with a very small counter jump, not a deep squat at all. They have to jump onto that box in an Olympic snatch catch position to even qualify to start training. And if you can't do that, starting with an Olympic lift is not the goal to create the pulse strength neurology that we're looking for. But now, again, I don't know how this stuff gets on the internet. I don't hate anything. I love it all. It's just, as you say, it's the match. So I say an athlete could do the metric test that I just described as a qualifier to start taking some weight with an Olympic bar. They've got the basic foundation now. I would like to see them leap up onto the box and land like a cat. I don't want to hear it. Very quiet. So now they're demonstrating their ability to relax, and they're honing it. Then I want to hear the opposite. I want to hear the foot plant, bam, on the box at the top. Now they've created the stiffened pulse that will then translate into an ability to catch the bar safely and athletically. So,
That's
again,
amazing.
It's
such a big impact.
I could go on for hours on how we're going to train that sequence to, again, create a resilient, sustainable athleticism. Is it for golfers? It wouldn't be my choice.
Well, I know, and I'm big fans of theirs, Dr. Rose at TPI and Greg Phillips. They have some very good videos out there where it'll be 20, 30 minutes long of players that have come in, whether they're on whatever tour they're on, or they're social media personalities that warrant being on their channel due to their following. But one of theirs that I was watching on leg strength was one of their criteria, and their question is, should you train for strength or should you train for speed? One of their criteria was you should be able to do 10% of your body weight in a split lunge squat. So if you're 200 pounds, 50 pounds dumbbells in each hand, you should be able to do 5 reps on each leg. And if you can't, then you're strength deficient. But if you can, or you can do more, then you need more speed training. It seems like they're trying to keep things in somewhat balance or based off what the individual needs. But you're going way, way deeper. Obviously, I mean, that was your career. You work with athletes all over.
Well,
and I'm sure they do. I'm just looking at what they're putting out there. I haven't sat down and talked to Greg or
you mentioned Charles Poliquin earlier,
Mm-hmm.
and I think that would have been Charles passed now, but he's that would be what I would think of as one of his great legacies. He measured cohorts of both Olympic and professional athletes of a very high caliber, and he would just do all these strength tests, and he'd say, okay, what does the average medalist cross-country skier do in a leg extension machine, an arm curl, a squat, with some technique criteria on top of that? Okay, these are bodies that have proven content validity. They've done it, that's what's required, and that's what they are. But having said that, if I gave you 3 swimmers, 3 wrestlers, and 3 high jumpers on the podium at the Olympics, or 3 shot putters and 3 discus throwers, or 3 javelin throwers, an astute person would know exactly the sport that those 3 are tuned for. So that body type suits a certain distribution of mobility and strength throughout their body. Mm-hmm. Will it fit you or me? No.
No, that's the thing. So, hopefully people will take from this that you look at a John Rahm or a Bryson DeChambeau, completely different build than a Justin Thomas, a Joaquin Neiman, and you would never train the two the same.
Right.
If you did, you should have your criteria license taken away.
Right.
So it's identifying what's needed, because hopefully everyone's taken from this. We've talked about a lot of different sports in relation to golf, to give examples, but the bottom line is find out what you need. That's the biggest thing, and then what exercise will give you that nutrition,
right,
so to speak.
So to summarize this, because we're leaving the listener a bit at sea here, so to speak, there is a base athleticism that I will stand by because I've measured this as a commonality among the spectrum of golfers, that being internal, external hip rotation ability plus pulse production plus core control. There are, I don't know if we'll call them non-negotiables, but there is a core base routine there, and then get with an expert and fine-tune it. Mm-hmm. And as I was saying, that's my relationship with a lot of the great coaches who I trust, and that's their role to do that fine-tuning.
That's where they come in.
Yeah. Anyway, I hope that gives a plan, shall we say, to the listeners who are wondering, well, where can I start with this? Okay, well, at least there's a base program here for the sport.
Yes, and hopefully that clarifies your position that no, deadlifts are not necessarily bad, or squats are not necessarily bad, if that's what that individual needs.
Right. Well, as I went through with the box jump, it's a fabulous neurological trainer, and we're going to potentiate that with landing hard, landing soft, mm-hmm. and playing with those variables. To do a deadlift, boy, that is a very stiffening, slowing. In other words, the best deadlifters really wedge in and stiffen under the bar. And if you're flexible, it's a kiss of death. You'll leak energy. You'll overload joints. It's not a good place to be under weight. However, think of the golfer's lift of the golf ball out of the cup. Plant one leg, project the other leg out behind you, bend over through the hips, and pull the ball. Okay, now let's workshop that a little bit. why don't you pick up a very modest 12-pound kettlebell with exactly the same strictness of form now. Let's stiffen up the core, a little more chest pride, shall we say, a little bit more of a push of the heel behind you, a little bit better balance. If you can't stand on one leg, I don't care how much you squat. It's really important for me that you can stand and hold that for 25 seconds, because that is what's determining the thrust line down into the ground. That's what the pros repeat, time and time again. The duffer, when we put them on the force plate, there's a big variability there. And once in a while, by dumb luck, they get it right. Well, okay, let's at least lock in that ability to balance. So, to your point, the one-legged deadlift of a kettlebell would be much more important in my hierarchy and line of thinking than a deadlift that will hide a lot of the translational
more
athleticisms.
applicable to that sport,
right.
And that movement.
Right.
One thing that I saw on one of your YouTube page or somebody posted was the cable hip hinge exercise.
Yeah.
So as an alternative to deadlifts, because it's so, again, we get into risk reward, and you get into ego. Somebody said, "Oh, I can do that deadlift. It's only 100 pounds. I want to do 200." And next thing you know, they're bulged a disc or herniated. Now they're out. Who knows how long? It could be indefinitely. They need surgery. Their golf career is over. But the hip hinge with the cable, as I employed that, it was, for me, it was much better to keep the alignment of the spine as opposed to trying to deadlift, whether it was off pins or off blocks or whatever it was. But I found the hip hinge, the weight, I don't know if I've lost that much strength or not through my history, but I think I was doing 50 or 60 pound plates, and that was plenty enough for me to get the benefit for some for some hip integrity and some strength, especially as I've crossed the 50, I'll call it the 50-yard line, not the 50-year line. I'm trying to maintain some general health, bone intensity or bone integrity, and so on. But that was a good alternative. And I know that there's others, that the bridge, for posterior chain development.
Sure.
People down the ground.
That
has limited risk, and you could put a plate on or a dumbbell, in your lap as you do that, and get it.
Well, you can go down that adding of the load, and the amount of muscle activation is not proportionate to the load. Believe it or not, it will bottom out. So, as a variant of that, think of this. Do a hip thrust, or whatever you want to call that exercise, with both legs.
Mm-hmm.
Then I want you to pretend you have a $100 bill in your butt cheeks, and someone's trying to pull it away from you. Don't let them have it. Up and down. Now, straighten one leg. So your left leg, the knee is bent, and you're pushing the heel down and thrusting up the hip. Your right leg is straight and stiffened to your torso. So there's a rotational component, but you are anti-rotation in the strength. Then what I want you to do is, your left leg is bent and the driver for the hip thrust. Now put that leg against the side of a coffee table or a weight rack or something.
So that the knee doesn't bulge out.
I want you to push out.
Oh.
Now try and do that exercise. I haven't increased the weight of the load on the pelvis or the load on the spine. Now we're going to see how athletic that hip external rotation mechanism is in a anti-rotational core, and then tell me how that sharpens up.
That's multiplanar.
Oh,
You're
absolutely,
working
it
multiplane
is.
Simultaneous.
Now tell me about your long drive and your slap shot in hockey, and your miles an hour on your fastball, and that kind of thing. So do you see how the tool to me is very important? And that's why over the years we spent so much effort trying to quantify the mechanics in terms of motion, joint stress, muscle activation profiles, what is the translation to the sport, and even if it is linked to the sport. Ultimately, I mean, we talked earlier about, okay, well, people talk about performances on the NFL Combine tests, and yet how many of those tests actually predict who's going to be a superstar in the NFL? The actual predictability is very low. NBA basketball, by the way, is much better. Some of those tests are much more predictive of how many rebounds.
Have you ever come up with, just as a doodling, wasting time? Not that you waste your time, but did you ever come up with or have some ideas that you jotted down as far as golf is concerned on what things could be conducted that would illustrate somebody has a proclivity?
Yeah, there are a few in our
golfer?
new Science of Golf video. So there are some assessment tests, and if the person is unable to competently do the test, here are some remedial exercises to address the deficits. And then some more multi-dimensional training, and getting down to that final taper to play the game well.
That seems to be something that is not very well known to the masses. And I had heard this, again, not to jump a different sport, but I had heard this a few years ago. And now I just saw it again about Luka Doncic, the basketball player, where he was obviously he's not very quick. Doesn't have great jumping ability, yet he's arguably one of the best players in the NBA. But what they found out was he was off the charts on his eccentric abilities.
Well, his ability to change direction.
Yes.
So when you look at the NBA Combine, there is the NBA lane agility test. Very predictive and correlative with performance. So there you go. So, even with NFL receivers, what's the metric? Well, it could be a 30-meter dash or a 20-meter dash or whatever that is. And then, I go back to some of the players years ago, and some of the great ones were terrible on those scores, but they could catch a ball, turn, come back, twist. In other words, their ability for directional change was the thing that was off the chart. But it's not measured by just a straight inline speed off the mark.
I've had Conrad Ray, who's the golf coach at Stanford. He's a friend of mine. Michael Bursin was at Wisconsin, and now he has a under par consulting where he helps place kids in college. I'll have to ask them, reach out to them to say, have you guys found anything? And Conrad and I did talk about this as far as recruiting, because he said kids today, teenagers, all of them can shoot under par. It's like a given where when I was a kid, if you shot under par, you consistently 1 or 2 under, you could probably pick your choice of Division I schools to go to. Where nowadays you better be 4 or 5 under.
Well, maybe you should ask that question of Greg Rose, because at TPI they have a few metrics.
Yeah, but what are you guys finding that can be a predictor in a recruitment process as far as measurements that a kid is going to be, boy or girl, is going to have greater potential than what they're showing right now?
Right. Well, I would not be the best person for that. I'm the one who says, I can tell you why I see a lot of the junior golfers. Dad brings me the golfer. The young woman or young man has just received a scholarship for a prestigious golf school, and now they're so injured that they are on the disabled list before they even start. What can you do, Doc? So I can tell you the commonalities there, and it is almost always someone got them to go out and just see how far they could hit balls, and 30 of them in a row. You just don't do that. Weight room bravado would be the next one. The next one is Dad has the golf athlete with the strength coach 3 days a week, the sports psychologist 2 days a week, the mobility stretching coach 2 or 3 days a week, the golf technique coach, plus the whatever. It goes on. And I look at the young athlete and I say, well, when was your last day off? And the room is silent. And I have to be very careful at that point, because I don't want the athlete to hear all of this. But I try and have a good talk with the parent and say, you do realize that no pro that I know of trains as intensely as your 17-year-old. And some of them don't want to hear it, but they say, okay, you've given me something. I see that. And here's my opinion, which you're paying for to have a workable intervention here. But anyway, those are some of the things that I can tell you are common among the young athletes who get sent, and they're already heavily compromised before they even
It's
start.
mind-boggling that exists today with all the literature that has come out to the public that used to be maybe in the university level, like Tudor Bompa's work, Dr. Greg Haff's work. I think they wrote Periodization of Training.
Yeah, all fabulous books.
Yes.
But it's the pattern. I don't know if you want to go here in this podcast or not, but again, this is the power of pattern recognition. Dad will call me or email me, and he doesn't talk about his son or daughter. He talks about we. We are training for this, and we are doing this, and then that is the number one red flag right out of the gate. Sir, it is not we. This is your son and daughter, the love of your life. And it's not because this is what you wanted to do when you were younger and couldn't because you had to support your family or whatever the story is.
Yeah.
This is your child who lives under exactly the same laws of science that every other human lives under. And you have to play by those rules. And with that kind of a talking to, we can create a foundation where, but you know, all of the other experts, the various coaches involved, don't even know what the other coaches are doing. So the first thing I might say as part of the strategy, get everybody around the table, and each one says what their objectives are with this person. Listen to what everybody else's are. And can you make this a program that follows the rules a little bit and give this young athlete the best chance? You know, and you have to love their passion. Here's dad spending all their money to try and help this happen. But I don't know if that has a place in our conversation or not.
I think we could have a whole multi-hour episode on junior golf and junior athletes in general, and the helicopter parents that are pushing them. As you said, the we, meaning they're wanting the kid to do what they were, for any particular reason, were unable to do or pursue, and now they're living and usually unknown. I don't think that they know, that they're consciously aware that they're doing that.
Absolutely. They have the best of intentions. Oh, absolutely. Yeah. But they don't know Tudor Bompa and this. I would suggest that today, with the world the way it is, with internet coaches, many of them wouldn't even know who the classic contributors to the very robust science that exists on creating resilient performance.
And even so, to go so basic is not specializing until they're in their mid to late teens. And even David's, what was his name? He wrote Range, the book Range, and the Sports Gene.
I know who you're talking about. He's the New York Times writer. Weinstein.
Yes.
Is it Weinstein or Goldstein?
I got both his books sitting on my desk.
They're fabulous books, by the way.
And he goes over the same thing. It's like, it's not, okay, if you subscribe to the Bompa era, if you know who he is, okay, that was decades ago. Maybe the new data and new science has changed. No, here come Range and Sports Gene that basically say the same exact thing in the modern era. So no, science has not changed. The physics of an anatomy have not changed in 50
this is
years.
the thing. You're correct. The human hasn't evolved in the last 10 or 15 years. But all of the so-called experts on the internet who are experts only because they're good marketers, they don't have to display their success rates or anything else to prove. It's just they're loud and sometimes they're crass, which gains attention. And why the public buys into it, I'm not quite sure. But
I think it's because some of the things they say are either they have the scientific jargon down very well and they sound like they know what they're talking about, and might even have some success at a local or even a regional level, but it's not extended success. I was recently at the PGA show, and they have an event called Open Forum that is I'm surprised they haven't asked you to talk at this thing. Of course, with your demands, you might have other things to do, but maybe it gets you to Orlando in January for a couple of days. But it's coaching, technology, and fitness is what their three main things are. And it starts about 5 o'clock on Tuesday and runs till about 11. And Chris Como is involved. He's one of the people that put it together. But there was a discussion about ground force reactions this year, because there was one individual who put some things out on social media that contradicted what Dr. Rose and Sasha McKenzie and James Lights and all these people are finding using the technology, and it was contradictory. But I have nothing against the individual who did it, but in looking at some of his posts on social media, where I could see somebody who's not very familiar, and even some of the coaches who might side with him say, okay, he's right and the rest of the industry's wrong. It can be very appealing to somebody who maybe just in general goes against the grain and wants to go do something else. So I think just as a whole, and again, nothing against that individual. If anyone knows him, and they'll know what I'm talking about, just using as example, but someone who gravitates towards anti-establishment, let's say, or they've done things their own way and they're going to gravitate towards someone who seems to be doing something similar. It's the way that they do something and not necessarily the information that they're buying into. That's kind of what I see.
Right. Well,
N equals 1 in that instance. So I don't know if that's industry-wide or worldwide.
yeah.
I see a pattern as we're talking about patterns. You see patterns in things. Why would someone gravitate towards someone who's so out there? It just hasn't proven over time. I mean, there's been outliers. I remember a guy in pitching back in the 80s or 90s had a very unique way of pitching coaching. It was a very much over-the-top movement that supposedly would save the elbow in the Tommy John surgery, which was so prevalent. And there were a few guys in the majors that used that and employed that theory, but it never really, those players never did anything that would warrant a whole flood of people going to this individual. So
Right.
it happens in all sports, and I think golf with the utilization and the instruction is so many things involved in playing good golf, not just the body, but the way you think and the way you swing and the way you train and clubs and the list is endless. So many things involved that people can get lost, and especially they get on the internet. Now they start searching the internet. And now they really get lost. It
Right.
could be a deep chasm. It's just too much.
Right. I know. It's why I just have to keep going back to the science and use that as a foundation. Otherwise, I would become influenced, shall we say, which...
Is there anything,
I
as you look back on your career, that you were certain that you were 100% correct at the time, that later on you had an aha moment that said, oh, no, oh, shoot, I was good intended, but I was wrong on this, and now I've changed. Was there any moments like that? And
well,
just to
this
illustrate
isn't golf
that we're not all
specific,
perfect.
but this is certainly science and biomechanics specific. So as a young biomechanics professor, I would teach that muscles are agonists and antagonists, and if you understand their activation and force, you will be able to describe human movement. As I evolved, I realized that didn't explain. So it will explain a very slow movement and perhaps with a moderate load, but it never explained high-performance sport. So remember, I was the guy measuring the role of all of these muscles and how they created the final execution of speed and power and balance and whatnot in the sport. And it wasn't until I appreciated that there are no, the separation of a muscle being an antagonist or an agonist. They're all agonists. And then I realized that there are many muscles that don't even connect to the skeleton. They only connect to the fascia. And the fascia is tightened and loosened. And, I could show you with an experiment. Say you did have neurogenic facilitation of your psoas muscle because of chronic back pain. I could show you that we could load that muscle and you could stretch it, and it really wouldn't release until we took your hand, put it overhead with a very strict arm push, bent away from if it were talking about the left psoas, bend to your right, drop the left shoulder back. It's the left arm that's pushing to the ceiling. Then push the heel of the hand to the ceiling and internally and externally rotate the arm. And now tell me if you can feel the psoas change. Some people, it won't matter. They don't have a strong anterior line of fascia. The next person, it goes from pain with internal rotation to no pain with external rotation, a heavy fascial connection. So now you start to realize that to release that psoas, you better release that whole chain on some people. So it was that it really pulled together the idea of technique. So we were talking about George St. Pierre earlier, and how there was a point in his career where all of a sudden his jab just became perfection. He would rotate the hips, stiffened core, turn the shoulders, got the long reach, and then that perfect pulsive muscle, and every single muscle in his body just about contracted at the same time to turn to granite. And that was the devastating jab that was. So it's just an example of there were no antagonists there. It was a perfect thrust line, but without fascia, it never would have happened. So I couldn't teach undergraduate biomechanics anymore. And now things got a little bit complicated. All my professorial colleagues, and by the way, I'm chair of department at this time, and I have to change my curriculum, and they weren't buying into it. You have to start somewhere and teach grade 1 biomechanics before you can go to grade 2 and grade 3, etc. But it was such a difficulty, and I would show these athletes and how I would measure them and what really created performance. And I hope I got that right in my last few years. But there would be an example of an evolution of a very basic idea, and how even to this day, I don't think many people really appreciate why a very modest-looking individual has set a world record in something.
Yeah, you can look at some people and say, that's a world record holder?
That's right, yeah. Yeah, swimmers certainly have a profile. Some of the fighters are so modest-looking.
Some of the best martial artists I know, and I don't know any MMA people. I know because the guys who I know are now in their late 50s and 60s. So MMA really wasn't sport.
Right.
In their era, they came up in kind of the Bruce Lee era,
right,
but had learned and trained in China and Japan. And you look at them and their age now, and I don't, one of them looks like not disparaging at all, just to paint a picture of like a Vietnam veteran who might be down on his luck. Hair's a little longer. He's got a big, thick beard.
Yeah.
But the pulsing, when he would punch, if he had his gi on, he'd break open a new gi. And once he got warmed up and started practicing punching, he would fray the end of his gi by the third punch.
Right.
It was so fast. And
we talked earlier before we got on the podcast today of Andrew Huberman's podcast, the Huberman Lab, and he had Pavel Tsatsouline on last week. Pavel, a good friend of mine, is about my size. He's about 6 foot, 180 pounds. He's got the strongest core I've ever measured. So he's the Russian kettlebell master, who you know.
Special force training.
Oh, Pavel is astounding. But if you walked up to Pavel on the street and you didn't know his strength and his abilities and his knowledge and his dedication to training with good form, with good structure, with good programming, with good intervals, you wouldn't think much, but grab a hold of him in a little
I'd rather not.
a little Greco-Roman hold, or just to have an arm wrestle with him. We're the same size. It is such an education for, I wish some of these internet gurus could, just go meet Pavel, and you'll get an education on what it is I'm talking about with technique and the astounding performance and strength out of a very modest-looking man.
Amazing.
Yeah.
I don't want to burn up. I've taken so much of your time today. You've been so gracious. I could talk about back hygiene and virtual surgery, but I hopefully we can save that for another time when you come to visit Hilton Head, and we can get together again and have another good breakfast or lunch or dinner and do another episode.
If people are interested in that, I wrote a book called Biomechanics. It's on Amazon, and that's my best effort for those who are having back pain that's limiting things they want to do in life. It talks about the tool of virtual surgery, which in a nutshell is to pretend you had surgery and now recover as if you did. Mm-hmm. And there's a natural deload there, pain tissues desensitize, and now you rebuild the body strategically with sufficient strength, sufficient mobility, and really tune it to suit your body. And believe it or not, if I took people who came to our experimental research clinic, and if they fell into the category that they've tried everything and they were told that surgery is your last hope, don't do the surgery, do the virtual surgery as described, 95% of them in a 2-year follow-up said they are happy with their lives and they're glad that's what they did. Now, that's not to say surgery doesn't work. Surgery is, it's for the right person.
It's needed for.
Oh, it's absolutely needed. Surgeons are at their best for the stenotic spine and nerves that are heavily compromised and compressed and whatnot. So I'm not suggesting that surgery doesn't have its role. However, for the people who have been told, and they just didn't realize it was their movement habits, and they were continuing the practice of keeping their tissues anchored.
Yeah, their spinal hygiene, as you refer to it, is terrible.
Right. So I'm sure you picked that up from Brian Carroll, who I'm actually going to, another great friend who I'm going to see on Monday. But there's that book to, when people read it, many of them don't ever need to see me or any of our clinicians.
Got it in the car. It's with me often as a reference.
Good. Well, I hope it helps a bit.
And you've been retired from your professor and professional career for a number of years.
Yeah, 10 years now I left the university.
Yes, but you have your BackFit Pro, which your daughter, I believe, is managing, and you have a certification.
Right.
A whole bunch of people that you've taught, passed on the knowledge that you had.
Right. I realized that I simply couldn't handle the volume of people requesting consults, so I set about training special clinicians starting 10 years ago, and they're on our backfitpro.com website with their contact coordinates. And I'm proud of them. They don't help 100% of people. No one ever does, but they help the majority.
And as far as a website, BackFit Pro is y'all's website. I'll obviously have a one-click link to that. And if you're in Des Moines, Iowa, or if you're in Switzerland, or if you're in somewhere around the world, it's all done by. It's very easy to navigate. You can click on whatever country you're in. You can click on wherever you are, and you can find somebody in your area or region if you're having issue. If you read Biomechanics and maybe you don't know if you're doing it right or have confidence, you can find one of your practitioners all around the world.
That was the plan.
It's worked. It's a good plan, and it came to fruition.
Yeah.
Anything that not that we could talk a lot about a lot of things, but anything that we missed as far as training and golf and spine and.
Well, not from my perspective, but only to say from our conversations leading up to today to make this happen and our breakfast together this morning, you're extremely well-read and knowledgeable. So thank you for all that you do in trying to help specifically the golf world to hit a little further for longer, shall we say.
It comes out of necessity. After having back issues myself, I would prefer to help others avoid the issues, and going through the trial and error of maybe doing a number of different disciplines or thoughts or theories, and some working, some not, some helping more than others, and at least trying to get to people like yourself to expose more people that might not have heard of you. I mean, I've been in golf for 40 years or around it since I was a kid, and really didn't hear. I kind of heard who you were about 15, 18 years ago, but never followed. Maybe I should have. I could be playing, and where are they playing this week? Wherever they're playing in Georgia. I don't know if it's Florida Swing. I think maybe I'd be playing the Champions Tour, but that wasn't meant to be. But hopefully my experience, and good and bad, can help somebody avoid or get better so they can get out to play and they can find your information and utilize it the best they can.
Well, I hope. But thanks for all of that. And it's been a really enjoyable time here, Pete. Thank you very much.
Thank you.
All right, everybody. Thank you so much for listening to today's show. If you enjoyed it, you can find more information on today's episode and other topics at golf360.blog. There you'll find the show notes and links related to this episode, as well as any other episode that we've done so far to date. If you're interested in improving your game and would like to learn more from yours truly by taking a private lesson, a half-day or multi-day school, club or putter fitting, you can reach me through the blog site or by email, pete@golf360.blog. So some of you may be asking, what is the golf paradigm? All you have to do is click on the homepage while on my blog site to discover how you can start playing better than you ever thought possible. Or you can simply sign up again on the blog page for my instructional videos, where I give regular tips on all areas of the game, to include the swing, club design and fitting, health, fitness and nutrition, the mental aspects, and equally as important, the integration of all those things together. I'm also on social media, and you can find me at The Golf Paradigm. That's PARADIGM. And I'm on Facebook, Instagram, and Twitter. And don't forget to subscribe to my YouTube channel, also under the same name, The Golf Paradigm. Facebook is usually the best way to reach me for questions and or comments, and I look forward to hearing what all of you have to say. This podcast is brought to you in part by Old South Golf Links. A short ride across a bridge from Hilton Head Island is one of the area's finest golf courses and a hidden treasure. Set up on towering pines and ancient oaks with sweeping marsh vistas, truly makes Old South Golf Links a one-of-a-kind golfing experience. The Clyde Johnson design was named one of the top 10 new public courses when it opened, and it also takes full advantage of the natural beauty of the Low Country. Old South is a fun and unique challenge for golfers of every skill level, and a favorite of both locals and visitors. Whether it's your first time here or you're a regular, you'll be treated and feel like family. From the bag drop to check-in at the fully stocked pro shop with both men's and women's apparel, to breakfast or lunch before or after your round, the staff is always ready and willing to help. Experience for yourself why Old South is one of the premier golf courses in the Hilton Head area, and why it will quickly become a favorite of yours too. Visit them in person or online at www.oldsouthgolf.com, or to make a tee time, simply call the pro shop at 843-785-5353.